Okay, I don't know what the problema is with the screen. I'm just doing a second session. Hope you are listening and know that TELUS list caught identity theft, trafficking, and unfortunately, any communication surrounding text and the wrongful use of technology have been immediately revoked. And um, any association with people using me for information in a wrongful manner have been rejected and unfortunately lost. I'm very sorry about the bad intentions, but certain clans don't understand Canadian law and don't understand rehabilitation when it involves wrong intentions about bodies. So unfortunately, I had to move on and change my path and know that if you were ever offered anything from anybody pretending to be your mother, they're being fake and you should reject them too because people act and have imposter syndrome, which is fraudulent activity, including including the fathers who previously abused the mothers. Now moving on to the next. U.S. Department of Labor Occupational Safety and Health Standards. Scope and application. This section applies to no occupational exposure to blood or other potentially infectious materials as defined by paragraph B of this section. Definition: for purposes of this section, the following shall apply. Assistant Secretary means the Assistant Secretary of Labor for Occupational Safety and Health or designed representative. Blood means human blood components, and product made from blood, human. Blood-borne pathogen means pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus and human immunodeficiency virus, HIV. Clinical laboratory means a workplace where diagnostic or other screening procedures are performed on blood or other potentially infectious materials. Contaminated means the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. Contaminated laundry means laundry which has been soiled with blood or other potentially infectious materials or may contain germs. Contaminated sharps means any contaminated object that can penetrate the skin, including but not limited to needles, scalpels, broken glass, broken capillary tubes, and exposed and dental wire. Decontamination means the use of physical or chemical means to remove, inactivate, or destroy blood-borne pathogens on a surface or item to the point where they are no longer capable of transmitting infectious particles, and the surface or item is rendered safe for handling, use, or disposal. Director means the Director of the National Institute for Occupational Safety and Health, U.S. Department of Health and Human Services, or designed representative. Engineering controls means controls, example sharps disposal containers, self-sheathing needles, safer medical device such as sharp with engineered sharp injury protection and vented glass system that isolate or remove the bloodborne pathogens hazard from the workplace. Exposure incident means a specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's duties. Hand washing facilities means a facility providing an adequate supply of rough and potable water, soap, and single-use towels or air drying machines. Licensed healthcare professional is a person whose legally permitted scope of practice allows him or her to independently perform the activity required by paragraph F, hepatitis B vaccination and post-exposure evaluation and follow-up. HBV means hepatitis B virus. HIV means human immunodeficiency virus. US system means a device that does not use needles for one, the collection of bodily fluids or withdrawal of bodily fluids after initial venous or arterial access is established. 2, the administration of medication or fluids, or 3, any other procedure involving the potential for occupational exposure to bloodborne pathogens due to percutaneous injuries from contaminated sharps. Occupational exposure means reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. Other potentially infectious materials means the following human body fluids: semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva and dental procedures, any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between body fluids. Any unfixed tissue or organ other than intact skin from a human living or dead, and HIV-containing cell or tissue cultures, organ cultures, and HIV or HPV-containing culture medium or other solutions, and blood, organs, or other tissues from experimental animals infected with HIV or HPV. Parenteral means piercing mucous membranes or the skin barrier through such events as needle sticks, human bites, cuts, and abrasions. Personal protective equipment is specialized clothing or equipment worn by an employee for protection against a hazard. General work clothes, uniforms, pants, shirts, or gloves not intended to function as protection against a hazard are not considered to be personal protective equipment. Production facility means a facility engaged in industrial scale, large volume, or high concentration production of HIV or HBV. Regulated waste means liquid or semi-liquid blood or other potentially infectious materials, contaminated items that would release blood or other potentially infectious materials in a liquid or semi-liquid state if compressed, items that are caked with dried blood or other potentially infectious materials and or capable of releasing these materials during handling, contaminated sharps, and the pathological and microbiological waste containing blood or other potentially infectious materials. Research laboratory means a laboratory producing or using research laboratory scale amounts of HIV or HPV. Research laboratories may produce high concentrations of HIV or HPV, but not in the volume found in production facilities. Sharps with engineered sharps injury protection means a non-needle sharp or a needle device used for withdrawing body fluids, accessing a vein or artery, or administering medication or other fluids with a built-in safety feature or mechanism that effectively reduces the risk of an exposure incident. Source individual means an individual, living or dead, whose blood or other potentially infectious materials may be a source of occupational exposure to the employee. Examples include, but are not limited to, hospital and clinic patients, clinics and clients in institutions for the developmentally disabled, trauma victims, clients of drug and alcohol treatment facilities, residents of hospice and nursing homes, human remains, and individuals who donate or sell blood or blood components. Sterilize means the use of a physical or chemical procedure to destroy all microbial life, including highly resistant bacterial endospores. Universal precautions is an approach to infection control. According to the concept of universal precaution, all human blood and certain human body fluids are treated as if known to be infectious for HIV, HPV, and other bloodborne pathogens. With practice controls means controls that reduce the likelihood of exposure by altering the manner in which the task is performed, prohibiting recapping of needles by a two-hand technique. The exposure control plan shall be reviewed and updated at least annually and whenever necessary to reflect new or modify the task and procedure which affect occupational exposure and to reflect new or revised employee position with occupational exposure. The review and update of such plans shall also reflect changes in technology that eliminate or reduce exposure to bloodborne pathogens and document annually consideration and implementation of appropriate commercially available and effective safe medical device designed to eliminate or minimize occupational exposure. An employer who is required to establish an exposure control plan shall elicit input from non-managerial employees responsible for direct patient care who are potentially exposed to injury from contaminated sharps in the identification, evaluation, and selection of effective engineering and work practice control, and shall document the solicitation in the exposure control plan. The exposure control plan shall be made available to the Assistant Secretary and the Director upon request for examination and copying. Exposure determination. A list of all job classifications in which all employees in those job classifications have occupational exposure. A list of job application classifications in which some employees have occupational exposure, and a list of all tasks and procedures or groups of closely related tasks and procedures in which occupational exposure occurs and that are performed by employees in job classification list in accordance with the provisions of paragraph C2IB of this standard. This exposure determination shall be made without regard to the use of personal protective equipment. Methods of compliance. General universal precautions shall be observed to prevent contact with blood or other potentially infectious materials. Under circumstance in which differentiation between body fluid types is difficult or impossible, all body fluids shall be considered potentially infectious materials. Engineering and work practice control. Engineering and work practice control shall be used to eliminate or minimize employee exposure. Where occupational exposure remains after institution of these controls, personal protective equipment shall also be used. Engineering controls shall be examined and maintained or replaced on a regular schedule to ensure their effectiveness. Employers shall provide hand washing facilities which are readily accessible to employees. When provision of hand washing facilities is not feasible, the employer shall provide either an appropriate antiseptic hand cleanser in conjunction with clean cloth paper towels or antiseptic towelettes. When antiseptic hand cleansers or towelettes are used, hands shall be washed with soap and warm running water as soon as feasible. Employers shall ensure that employees wash their hands immediately or as soon as feasible after removal of gloves or other personal protective equipment. Employers shall ensure that employees wash hands or any other skin with soap and water, or flush mucous membranes with water immediately or as soon as feasible following contact of such body areas with blood or other potentially infectious materials. Contaminated needles and other contaminated shrubs shall not be bent, recapped, or removed, except as noted in paragraphs D2B2A and D27A and D27B below. Shearing or breaking of contaminated needles is prohibited. Contaminated needles and other contaminated sharps shall not be bent, recapped, or removed unless the employer can demonstrate that no alternative is feasible or that such action is required by a specific medical or dental procedure. Such bending, recapping, or needle removal must be accomplished through the use of a mechanical device or a one-hand technique. Immediately or as soon as possible after use, contaminated reusable sharps shall be placed in appropriate containers until properly reprocessed. These containers shall be puncture resistant, labeled or color coded in accordance with the standard, leak-proof on the sides and the bottom, and in accordance with the requirements set forth in paragraph E42E for reusable sharps. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lens are prohibited in work areas where there is a reasonable likelihood of occupational exposure. Food and drink shall not be kept in refrigerator, freezer, shelf, cabinet, or on countertop or bench top where blood or other potentially infectious materials are present. All procedures involving blood or other potentially infectious materials shall be performed in such a manner as to minimize splashing, spraying, spattering, and the generation of droplets of these substances. Mouth pivoting, suctioning of blood, or other potentially infectious materials is prohibited. Specimens of blood or other potentially infectious materials shall be placed in a container which prevents leakage during collection, handling, processing, storage, transport, or shipping. The container for storage, transport, or shipping shall be labeled or color coded according to paragraph G line I and closed prior to being stored, transported, or shipped. When facility utilizes universal precautions in the handling of all specimens, the labeling, color coding of specimens is not necessary provided containers are recognizable as containing specimens. This exemption only applies while such specimens containers remain within the facility. Labeling or color coding in accordance with paragraphs G1I is required when such specimens containers leave the facility. If outside contamination of the primary container occurs, the primary container shall be placed within a second container which prevents leakage during handling, processing, storage, transport, or shipping, and is labeled or color coded according to the requirements of this standard. If the specimen could puncture the primary container shall be placed within a secondary container which is puncture resistant in addition to the above characteristics. Equipment which may become contaminated with blood or other potentially infectious materials shall be examined prior to servicing or shipping and shall be decontaminated as necessary unless the employer can demonstrate that decontamination of such equipment or portions of such equipment is not feasible. A readily observable label in accordance with paragraph G1IH shall be attached to the equipment stating which portions remain contaminated. The employer shall ensure that this information is conveyed to all affected employees, the servicing representative, and/or the manufacturer as appropriate prior to handling, servicing, or shipping so that appropriate precautions will be taken. Personal protective equipment provision. When there is occupational exposure, the employee shall provide at no cost to the employee appropriate personal protective equipment such as, but not limited to, gloves, gowns, laboratory coats, face shields or masks and eye protection and a mouthpiece, resuscitation bag, pocket mask, or other ventilation device. Personal protective equipment would be considered appropriate only if it does not permit blood or other potentially infectious materials to pass through to or reach the employee's work clothes, street clothes, undergarments, skin, eyes, mouth, or other mucous membranes under normal conditions of use and for the duration of time which the protective equipment will be use. The employer shall ensure that the employee use appropriate personal protective equipment unless the employer shows that the employee temporarily and briefly declined to use personal protective equipment when, under rare and extraordinary circumstance, it was the employee's professional judgment that in this specific instance its use would have prevented the delivery of health care or public safety services or would have posed an increased hazard to the safety of the worker or co-worker. When the employee makes this judgment, the circumstance shall be investigated and documented in order to determine whether changes can be instituted to prevent such occurrences in the future. Accessibility. The employer shall ensure that appropriate personal protective equipment in the appropriate size is readily accessible at the worksite or is issued to employees. Hypoallergenic gloves, glove liners, powderless gloves, or other similar alternatives shall be readily accessible for those employees who are allergic to the gloves normally provided. Cleaning, laundering, and disposal. The employer shall clean, launder, and dispose of personal protective equipment required by paragraphs D and E of this standard at no cost to the employee. Repair and replacement. The employer shall repair or replace personal protective equipment as needed to maintain its effectiveness at no cost to the employee. If a garment is penetrated by blood or other potentially infectious material, the garment shall be removed immediately or as soon as feasible. All personal protective equipment shall be removed prior to leaving the work area. When personal protective equipment is removed, it should be placed in an appropriately designated area or container for storage, washing, decontamination, or disposal. Gloves. Gloves should be worn when it can be reasonably anticipated that the employee may have hand contact with blood, other potentially infectious materials, mucous membranes, and the non-intact skin when performing vascular access procedures except as specified in paragraph D3(4)(d), and when handling or touching contaminated items or surfaces. Disposable single-use gloves, such as surgical or examination gloves, shall be replaced as soon as practical when contaminated or as soon as feasible if they are torn, punctured, or when their ability to function as a barrier is compromised. Disposable single-use gloves shall not be washed or decontaminated for reuse. Utility gloves may be decontaminated for reuse if the integrity of the glove is not compromised. However, they must be discarded if they are cracked, peeling, torn, punctured, or exhibit other signs of deterioration, or when their ability to function as a barrier is compromised. If an employer in a volunteer blood donation center judge that routine gloving for all phlebotomy is not necessary, then the employer shall periodically reevaluate this policy, make gloves available to all employees who wish to use them for phlebotomy, not discourage the use of gloves for phlebotomy, and require that gloves be used for phlebotomy in the following circumstance. When the employee has cuts, scratch, or other break in his or her skin, when the employee judged that hand contamination with blood may occur, for example, when performing phlebotomy on an uncooperative source individual, and when the employee is receiving training in phlebotomy. Mask, eye protection, and a face shield. Mask in combination with eye protection devices such as goggles or gauze with solid side shields or chin-length face shield sh- shall be worn whenever splash, spray, spatter, or droplets of blood or other potentially infectious materials may be generated and eye, nose, or mouth contamination can be reasonably anticipated. Gowns, aprons, and other protective body clothing. Appropriate protective clothing, such as but not limited to gowns, aprons, lab coats, clinic jackets, or similar outer garments, shall be worn in occupational exposure situations. The type and characteristics will depend upon the task and the degree of exposure anticipated. Surgical caps or hoods and/or true covers or boots should be worn in instances when gross contamination can reasonably be anticipated. Example: autopsies, orthopedic surgery.